Welcome back to WKRG News 5 at noon. Today the doctor is in. We are happy to welcome Dr. Alex Marakian with the Southern Cancer Center to our studio today. Dr. Marakian, thanks for being with us.
Thanks for having me, Devin.
All right, so November is Men's Health Awareness Month, and today we're going to talk about some of the screenings that men need to have. And I'm not trying to be sexist here, but sometimes men are not the best about getting their screenings. So what are some of the regular things they need to have done?
That's very true. They are very poor at that. But the three commonest cancers that men face are prostate cancer, lung cancer, and colorectal cancer. So it's important to get those cancers screened for.
All right, let's start with prostate cancer. When do men need to be screened for this?
Well, there's been a lot of debate about when they should be screened, and a lot of different advice given by different government institutions. I think if you've got a family history of it, certain ethnic groups like African Americans are at higher risk of getting the disease and dying from it. But I think if you're concerned, speak to your doctor, and probably around 40 years of age would be a good starting point.
Okay, let's move on to the colonoscopy, the dreaded colonoscopy. It's such an important test. When do men need to have this?
Look, I just had one recently, and it wasn't actually that bad.
Right.
50 is the recommended age for colonoscopy. Some people use Cologuard, where they test their feces at home. It's not a substitution for getting a colonoscopy, so start with that. If you're clear, it's now recommended every 10 years is sufficient.
Okay, all right. And if you have a family history, again, a little bit younger.
Yes.
And quickly, before we run out of time, lung. So what about, I didn't realize you should get a lung cancer screening.
Yes, the government will pay for a screening test. It's a low-dose CT scan for people who have 30 years of smoking history, who've not quit within the last 15 years, but they're going to lower that to 20, I believe, pretty soon.
That's great. Okay, so we are going to be on Facebook Live in just a few minutes, and if you have any questions about men's health screenings that you need, we're going to be talking a lot about, you are a radiation oncologist, and you can talk about how some of these cancers can be treated with really targeted radiation.
Correct. Yes, we've made some great inroads into the technology, so side effects are very minimized. I know a lot of people are frightened of radiation, but really the side effects are few and far between these days.
All right, we're going to have a great conversation at 12:30. We hope you'll log on to the WKRG Facebook page. But again, Dr. Alex Marakian with Southern Cancer Center, thanks so much for being our guest.
Thank you, Devin. Thanks for having me.